A letter arrives in your mailbox. At first glance, it looks routine, but buried inside could be a deadline that determines whether your disability benefits continue uninterrupted or suddenly stop. At the very same time, millions of Medicare beneficiaries are unknowingly skipping a free health service that could identify serious medical concerns before symptoms become obvious. One issue could affect your monthly income, the other could affect your long-term health, yet many people remain unaware of both until it's too late. That is why today's discussion is so important. We are going to break down the medical review process connected to Social Security disability benefits, explain why more reviews are taking place than many people expected, and reveal a Medicare-covered preventive service that countless beneficiaries have never used, even though they are entitled to it every year at no additional cost. If you or someone you know receives Social Security disability insurance, supplemental security income based on disability, Medicare, or survivor benefits connected to disability programs, this information could prove extremely valuable in the months ahead. Before we continue, take a moment to subscribe and enable notifications so you can stay informed about benefit updates, Medicare changes, and important deadlines that could affect your finances and healthcare decisions. Information is most useful when you receive it before a deadline arrives, not after. Let's begin with the issue that tends to generate the most concern whenever people hear about it: Social Security medical reviews. Many people hear the phrase medical review and immediately assume it means their benefits are about to end. That is not necessarily true. In fact, one of the biggest misunderstandings surrounding Social Security disability programs is the belief that receiving a review notice automatically means payments are being terminated. That is not how the process works. The Social Security Administration conducts what are known as continuing disability reviews, commonly referred to as CDRs. These reviews are designed to determine whether an individual receiving disability benefits continues to meet the medical requirements established under Social Security rules. The purpose is not to punish beneficiaries. Instead, the agency periodically evaluates whether a person's medical condition still prevents substantial work activity. It is important to clarify something right away. If you are receiving standard Social Security retirement benefits because you reached retirement age, these medical reviews generally do not apply to your retirement payments. Retirement benefits are not dependent upon a disability determination. The review process is primarily connected to disability-based programs such as SSDI and SSI disability benefits. For individuals receiving disability benefits, however, these reviews remain an ongoing part of the system. Depending on the nature of the medical condition, reviews may occur at different intervals. Some individuals may be reviewed relatively frequently if improvement is considered possible. Others may go many years between reviews if their condition is considered permanent or unlikely to improve. What has attracted increased attention recently is the pace at which reviews are being processed. Administrative changes and efforts to reduce backlogs have increased review activity compared with previous years. For beneficiaries who have not heard from the agency for a long time, this means there may be a greater chance of receiving correspondence requesting updated information. If a review notice arrives, understanding what happens next can eliminate a great deal of anxiety. Typically, the first step involves receiving paperwork requesting updated information regarding your condition. You may be asked about your medical treatment, recent doctor visits, medications, hospitalizations, therapy sessions, work activity, and any changes in your physical or mental health. The agency uses this information to determine whether additional review is necessary. Many cases are resolved through paperwork alone. If the submitted information indicates that the disabling condition continues and there is no evidence of significant improvement, the review may conclude without substantial additional action. Other cases may require more detailed medical evidence or further evaluation. One of the most important things beneficiaries can do is maintain consistent medical care whenever possible. Medical records often become the strongest evidence supporting a continued disability determination. Regular appointments, documented symptoms, treatment plans, medication records, specialist evaluations, and ongoing monitoring all help create a clear picture of an individual's condition over time. Problems sometimes arise when treatment records become sparse. If there are lengthy gaps with little or no documented medical care, it can become more difficult to demonstrate the ongoing severity of a condition. This does not automatically mean benefits will end, but complete and current records often provide stronger support during the review process. Another key point involves deadlines. When Social Security sends requests for information, responding promptly is extremely important. Ignoring letters or delaying responses can create unnecessary complications. Even individuals who believe their condition clearly qualifies should never assume paperwork can be safely set aside for later. Timely responses help keep the process moving smoothly and reduce the risk of avoidable interruptions. Some beneficiaries also worry about what happens if the agency ultimately determines that benefits should stop. In those situations, appeal rights exist. Understanding the applicable deadlines becomes essential because certain appeal windows may affect whether benefits can continue while the appeal is being considered. Missing deadlines can significantly change available options, which is why reading every notice carefully remains so important. The frequency of reviews varies based on the expected likelihood of improvement. Conditions classified as likely to improve may be reviewed more often. Conditions expected to remain stable or permanent may be reviewed less frequently. While every case is unique, the central question generally remains the same. Has the individual's medical condition improved enough to allow substantial work activity? That question sits at the heart of every continuing disability review. Now, here is where many viewers may think this discussion only applies to disability beneficiaries. But the second half of today's topic affects a much larger audience. In fact, it applies to millions of Americans enrolled in Medicare, including many retirees who have never received disability benefits at all. And surprisingly, a large number of those individuals are missing out on healthcare services that Medicare already covers. Think about that for a moment. Many people spend years worrying about medical expenses, trying to manage healthcare costs, and deciding whether certain appointments are worth scheduling. Meanwhile, Medicare provides preventive services that are available with little or no out-of-pocket cost for eligible beneficiaries, yet countless people never take advantage of them. One service in particular deserves much more attention because it focuses entirely on prevention rather than treatment. This service is known as the Medicare Annual Wellness Visit. Despite its importance, many beneficiaries either do not know it exists or misunderstand what it actually involves. When people hear the word wellness visit, they often assume it is simply another version of a traditional annual physical examination. However, the annual wellness visit serves a different purpose. Instead of focusing primarily on diagnosing current illnesses through a head-to-toe physical exam, the visit is designed to create and update a personalized prevention plan. The goal is to identify risks before they become major problems and help beneficiaries stay healthier over time. During the visit, healthcare providers review a wide range of information. They may discuss current medications, family medical history, lifestyle factors, existing health conditions, preventive screening schedules, and other factors that contribute to overall health. The process helps identify areas where additional monitoring or preventive care may be beneficial. Basic health measurements are typically reviewed. Discussions may focus on mobility, safety concerns, fall risks, nutrition, activity levels, and general wellness. These conversations can reveal issues that otherwise might remain unnoticed until they become more serious. One area receiving growing attention involves cognitive health. As people age, concerns about memory, concentration, decision-making abilities, and other cognitive functions naturally become more important. Early identification of potential cognitive changes can provide valuable opportunities for further evaluation and planning. Many individuals assume cognitive concerns become obvious immediately. In reality, subtle changes can develop gradually. Family members may overlook early warning signs. Individuals themselves may dismiss changes as normal aging. Structured discussions and screenings can help identify situations where additional assessment may be appropriate. This is one reason the annual wellness visit can be so valuable. It creates a dedicated opportunity to discuss these topics in a preventive setting rather than waiting until significant symptoms emerge. Because the visit focuses on prevention, it can also encourage conversations about other important health risks. Falls, for example, represent one of the leading causes of serious injuries among older adults. A simple discussion about balance issues, home safety, medications, or mobility challenges can sometimes prevent injuries that would otherwise result in hospitalization or long-term complications. Likewise, discussions about depression, emotional well-being, social isolation, and daily functioning may uncover concerns that deserve additional attention. Many people do not realize how much information can emerge from a conversation focused specifically on preventive care rather than immediate illness. The visit essentially helps create a roadmap for future healthcare decisions. It identifies recommended screenings, preventive services, vaccinations, and follow-up actions based on individual risk factors. Rather than taking a one-size-fits-all approach, it emphasizes personalized planning. And perhaps most importantly, it encourages people to become proactive about their health instead of reacting only after problems develop. The reality is that prevention often receives less attention than treatment because prevention does not generate dramatic headlines. Yet some of the most meaningful healthcare outcomes result from identifying risks early and addressing them before they escalate. That is why understanding available Medicare preventive services can be so important. Many beneficiaries spend years faithfully attending appointments for existing conditions while overlooking preventive benefits specifically designed to help maintain long-term health. One of the biggest reasons people miss out on Medicare preventive benefits is surprisingly simple. They never ask for them correctly. Many beneficiaries call their doctor's office and request a yearly checkup or annual physical, assuming that is the same thing as the Medicare annual wellness visit. In reality, these appointments may be handled differently, and understanding the distinction can help avoid confusion. When contacting your healthcare provider, it is often helpful to specifically ask about the Medicare annual wellness visit. Using the proper name allows the office staff to determine the correct appointment type and explain how it works within your Medicare coverage. A simple phone call could open the door to preventive services that many people overlook year after year. For individuals who are relatively new to Medicare, there may also be preventive visit options available during the early stages of enrollment. Healthcare providers can explain which appointment best fits your situation and whether you qualify for specific preventive services. What makes these visits particularly valuable is not just the appointment itself, but everything that can follow from it. The information gathered can help identify screenings, evaluations, and preventive measures that may reduce future health risks. And this brings us to another important point. The annual wellness visit is only one piece of a much larger preventive care system available through Medicare. Many beneficiaries are surprised to learn how many screening opportunities exist. Depending on individual risk factors, age, medical history, and eligibility requirements, Medicare may cover preventive services related to cardiovascular health, diabetes, various cancers, bone health, mental health, and other important areas of wellness. For example, cardiovascular disease remains one of the most significant health concerns among older adults. Monitoring cholesterol and other cardiovascular risk indicators can provide important information about heart health and future risks. Preventive screenings help healthcare providers identify concerns that may benefit from additional attention. Diabetes screening represents another valuable preventive tool. Millions of Americans either have diabetes or are at risk of developing it. Early identification can make a meaningful difference because lifestyle adjustments, medical management, and monitoring are often more effective when concerns are addressed sooner rather than later. Cancer screenings also play a major role in preventive healthcare. Depending on age, risk factors, and medical history, individuals may qualify for screenings designed to identify certain forms of cancer before symptoms appear. Early detection can significantly expand treatment options and improve outcomes in many situations. Bone health is another area that deserves attention. particularly among older adults. Bone density changes often occur gradually, and many people do not realize their risk until a fracture occurs. Preventive evaluations can help identify concerns before they lead to serious injuries. Mental health and emotional well-being are equally important. Depression can affect individuals of any age, but it is often under-recognized among older adults. Preventive discussions create opportunities to identify symptoms, explore treatment options, and connect individuals with appropriate support resources. The value of preventive care lies in its ability to reveal issues that might otherwise remain hidden. Most serious health conditions do not appear overnight. They develop gradually. Risk factors accumulate, symptoms emerge slowly. Problems often begin long before individuals realize something is wrong. Preventive healthcare creates opportunities to identify those warning signs early. That is why healthcare professionals consistently emphasize prevention. It is generally easier to manage risks before they become major medical events than after they occur. Vaccinations provide another excellent example. Many beneficiaries focus on doctor visits and medications while overlooking recommended immunizations. Yet vaccines continue to play an important role in protecting older adults from illnesses that can lead to serious complications. Depending on eligibility and medical guidance, Medicare coverage may include vaccines related to influenza, pneumonia, shingles, COVID-related protection, RSV, and other recommended immunizations. Staying current with preventive vaccinations can help reduce the risk of severe illness and hospitalization. Another development attracting attention involves increased access to certain testing services through participating pharmacies. For many individuals, especially those living in rural communities or areas with limited healthcare access, pharmacies provide a convenient option for obtaining certain healthcare services without lengthy waits for appointments. This increased accessibility may allow individuals to seek testing and evaluation more quickly when symptoms arise. Convenience matters because people are often more likely to use healthcare services when they are easy to access. Now let's connect everything we've discussed today because there is a common theme running through both Social Security disability reviews and Medicare preventive care. The common theme is preparation. People who stay informed, maintain records, respond promptly, and take advantage of available preventive services are often in a stronger position than those who wait until a problem develops. For disability beneficiaries, preparation means keeping medical records current, maintaining consistent treatment when possible, carefully reviewing official notices, and responding to requests for information on time. Small actions taken today can prevent major complications later. For Medicare beneficiaries, preparation means understanding available preventive services, scheduling appropriate appointments, discussing concerns with healthcare providers, and taking advantage of screenings designed to identify risks before they become serious problems. Neither of these subjects tends to receive much attention in everyday conversations. Most people do not discuss disability reviews until they receive a notice. Most people do not think about preventive screenings until a doctor recommends one. Yet both can have a significant impact on quality of life. Imagine two individuals. The first ignores paperwork, postpones appointments, and assumes everything will work out on its own. Important deadlines pass. Opportunities for preventive care are missed. Questions go unanswered. The second stays informed, keeps records organized, schedules recommended preventive visits, and addresses issues as they arise. Neither person can predict the future, but one has placed themselves in a much stronger position to handle whatever comes next. That difference matters. It matters when a review notice arrives. It matters when a healthcare provider recommends screening. It matters when early detection identifies a problem before symptoms become severe. And it matters when access to accurate information helps individuals make informed decisions about their benefits and healthcare. Another important reminder is that rules, procedures, and available services can change over time. Healthcare programs evolve. Administrative processes are updated. New preventive options become available. Remaining informed helps ensure you are aware of opportunities that may benefit you. Too often, People learn about valuable services years after they became eligible. Others discover important deadlines only after they have already passed. Knowledge alone cannot solve every challenge, but it can help individuals avoid preventable mistakes and make better decisions. If you currently receive disability benefits, this may be a good time to review your records, confirm that important documents are organized, and ensure your contact information is current. Being prepared before a review notice arrives is usually easier than scrambling after one appears. If you receive Medicare benefits, consider speaking with your healthcare provider about preventive services that may be available to you. Ask questions, learn about recommended screenings, understand which services fit your personal health situation. The goal is not to create fear. The goal is awareness. A disability review is not automatically bad news. A preventive screening is not something to avoid. Both are tools designed to help manage important aspects of life, financial stability in one case and personal health in the other. The individuals who benefit most are often those who understand how these systems work before they need them. As we wrap up, remember the key takeaways from today's discussion. If you receive disability-based Social Security benefits, stay alert for official correspondence, maintain ongoing medical documentation, and respond promptly to requests for information. Understanding the review process can reduce stress and help you navigate it more effectively. If you receive Medicare, take time to learn about preventive services available to you. The Medicare Annual Wellness Visit can provide valuable insights into your health, identify potential risks, and help create a personalized plan for future care. Preventive screenings, vaccinations, and wellness evaluations exist for a reason, and taking advantage of them may provide benefits far beyond what many people realize. Most importantly, do not assume that valuable information will always find its way to you automatically. Sometimes the people who gain the greatest advantages are simply those who ask questions, stay informed, and take action before deadlines and opportunities pass. Thank you for spending this time with us today. If you found this information helpful, consider sharing it with friends, family members, caregivers, or anyone receiving Social Security disability benefits or Medicare coverage. A single conversation can sometimes help someone avoid a costly mistake or discover a healthcare benefit they never knew existed. Stay informed, stay proactive, and continue looking for ways to protect both your benefits and your health for the future. Benefits Blueprint USA.